We've got a question in from Deborah. This was emailed to us at questions@askjoedimatteo.com. That is where you can get your questions answered if you would like to. She wanted to know, high blood pressure has always been an issue with me. I take medication, which helps sometimes. However, it still seems high on occasions. Is there anything I should do or take?
As always, I think there's always questions that pop up after reading a question like that. So specifically would be, which blood pressure medications are you actually taking at this point? What does seems high actually mean? Is she routinely checking this on her own? Is she checking it from home? Is she going to a pharmacy and getting it checked? Has she had 100 doctor appointments? Are these like regular in-office readings? Is this something that you just feel?
Is it an election year?
Is it? Exactly. So I think, again, just trying to understand maybe more of the context on her end. I don't know if you have anything to add. Just from that standpoint.
Same kind of thing that I hung on to is the high on occasions. So I think, again, there's different ways to go. The way I ended up taking it is that the high on occasions means that she's checking it. And I'm reading a lot into this, but this is just what I rolled with. She's checking it on her own, because if it was high at every doctor visit or every other doctor visit, her meds would probably be adjusted. So I'm assuming that she's okay at the doctor's office. She's okay a lot of time. Occasionally, though, she's throwing on that cuff or stopping at a pharmacy and putting on the cuff and running high. That's for the purposes, and there's other, again, we can make it more broad, but that's the way I took it. But I had the same question. What does high on occasions mean?
Yeah. And then I'm glad that you went there with it, because when looking at just like the various hypertension guidelines, let's say, in terms of how it's treated and how it's assessed, something so simple as just getting a blood pressure reading, at this point it's like, blood work, blood pressure, it's so easy. It's done right all the time. There's no issues. Well, in fact, blood pressure, the machine that's testing it, the individual that's testing it, where you're testing it, the setting in which the blood pressure reading is being taken is all important. I think those are all things we can kind of get into here, because beyond making a supplement recommendation or a medication recommendation or change, I think, again, just understanding how important proper readings or the proper settings for readings is something that we want to
definitely
kind of want to get to. And then even what Joey was alluding to is something called masked hypertension.
Oh,
so
okay.
You go to the doctor's office, you're within a normal range or within the range that they're, the goal that they're looking for. But then when you go home or just in daily living, you're running this higher, you're running higher blood pressure.
Interesting.
So,
that's opposite of what I would expect. I would think that the white coats come in and your blood pressure spikes.
Yeah, that's a very specific thing, though.
Yeah,
you know what I mean?
Yeah, the guidelines, they sort of split it up into those two categories of, sort of like ancillary issues. So you have the hypertension that isn't overt, where you go to the office, the readings are within a normal range, and then throughout daily living, it's elevated, and then masked, white coat.
Okay, so that is a thing.
Hypertension is the opposite.
And so white coat hypertension isn't a big deal, because it's a very specific stimulus and response.
It is a big deal, but it's a very individualized psychological issue. Essentially, which becomes a physiological or physical issue. But if you feel like you're being tested, you're under pressure, this blood pressure reading, oh my God, what's going to happen? And you start to get elevated in that way, then you get the white coat syndrome. But some people, they've been sitting down for 10 minutes, 15 minutes at their appointment. They're relaxed. It's routine.
Yeah.
Versus, you may say you stop at, the local pharmacy and get your blood pressure checked. You may have just been, especially if you're elderly, not real active, you may have just been pushing your shopping cart around for 10 minutes, and then you sit there and test your blood pressure.
Right.
It's going to be elevated. We recommend 5 minutes ideally of being stationary and a minimum of 3 minutes. So that's a key thing too. And then to what Dante was saying, I would try not to get tested. Well, you test it once or twice a week. One time it's at the pharmacy, one time it's this person, one time it's at home. Try to stay consistent. Because even if that machine has some flaws, at least they become, everyone has a flaw.
Right.
Versus the different flaws you're trying to put
You can see
together.
a trend.
Mm-hmm.
Yes.
Yeah, exactly. And the other thing I wanted to add with white coat hypertension.
Yeah.
Joey said it, it is a big deal, because again, even if it's, even if they confirm that, yes, your blood pressure only becomes elevated at these appointments, regardless, your doctor's going to want to try to do additional investigation or testing. So there's ambulatory blood pressure monitoring tests that are often, patients are sent home with. And so you get 24-hour readings of your blood pressure.
So you can actually watch it in real time, more or less.
And granted, you are going to have fluctuations, when you exercise or when you're, doing more, when there's more physical exertion and such, but they have ways of quantifying resting, because really what we're looking at here is resting blood pressure. That's the key. Those transient elevations in blood pressure when you're exercising, those are the instances where there's benefit.
That's acting as it should, right? We want to have more blood pressure when we need that infusion. That makes sense.
And it's a huge issue then when somebody has normal blood pressure at the office, and then they come home, and their elevations are more notable, and so then
masked hypertension.
Yes, and so in essence, looking at Deborah's question, that's kind of what we can imply here.
And just in the most basic form of things we deal with every day. When you're under stress, maybe you think, well, stress leads to high blood pressure. But just in a quick nutshell of how that happens, basically that's fight or flight. Your body releases catecholamines, releases adrenaline. That's your body essentially entering a ready state. It releases glucose. It's basically getting your body ready to fight. So when you're under stress, and even if it's just that chronic daily stress, that can raise your blood pressure. Also, when your blood sugar is low, catecholamines, that same adrenaline gets released by the body to help again release glucose because your blood sugar is low. So you may be running high blood pressure at a given time because you haven't eaten all day.
Wow.
So just to watch out for some symptoms of low blood pressure: fast heartbeat, shaking, sweating, nervousness, anxiety. All those things kind of go in with that fight or flight or stress. If you can tell, there's a lot of overlap there.
Yeah.
Irritability, dizziness, hunger. So just everyday things that can be occurring that may affect that number that you get on a Thursday versus the next Thursday. Also dehydration. When you're dehydrated, your body releases vasopressin. So what's that trying to do? That hormone via the kidneys, it helps you to retain water because you're dehydrated. But what that's also doing constricts blood vessels. That's a byproduct. Your blood pressure goes up. So just understanding the basic mechanism of how everyday things we all deal with, a little bit of low blood sugar, a little bit of stress, a little bit of dehydration can affect your blood pressure reading pretty significantly.
Okay, so Deborah needs to make sure that she's hydrated. She needs to make sure that she's eating appropriately and keeping her blood sugar stable, which is just a good idea in general. You don't want that spiking all over the place.
Because when you look at it broadly, these are things that we should be looking out for our health throughout the day.
Right.
Because if they're causing spikes in blood and blood pressure, they're doing other things to your body. And if you're in this state chronically, it's more than just about that test or that reading that day.
Right.
And caffeine to watch too. That is kind of more of a, I don't want to call it an artificial reading, but it is something to be aware of. You begin to see the effects of caffeine on blood pressure 30 minutes after ingestion. It can be up to 4 hours.
Wow.
So depending on what your body's used to, if you have an abnormal amount that day, et cetera, no enemy of caffeine in moderate amounts by any means, but it's just something to be aware of.
Sure. Okay. All right. So those are all great things that she needs to keep an eye on. Is there anything else that she can do specifically to help reduce her blood pressure, assuming it is a little bit higher than it should be? She's already taking medication. Is there anything else she should be doing?
Realistically, just when we talked about high cholesterol or stroke or whatever the case, there's non-pharmacological interventions that can be made. There's pharmacological interventions that can additionally be made in her case.
Sure.
So if we just start broadly looking at the non-pharmacological, we can first kind of start with the big one. You look at somebody's dietary patterns. And so why would we do that? Weight loss, if somebody is, qualifies for the need to lose weight, let's just say, you can potentially see upwards of a 1 point of blood pressure lowering per 1 kilogram of body weight loss. So that's 2.2 pounds.
Wow.
For each 2.2 pounds that you lose, theoretically there's a marked blood pressure lowering effect there.
So if you lose 22 pounds, roughly speaking, 10 points of blood pressure reduction.
Right. Again, that's that's looking at a large group average.
Sure.
But at the same time, that's, just because it's a lifestyle intervention, that's a pretty big one.
That is.
Yeah.
So, and then dietary breaks down into, a whole host of other recommendations, trying to reduce dietary sodium and increase dietary potassium.
Okay.
Now, the big thing there, we could tell Deborah, try to eat less than, 4 grams of sodium per day and try to eat X grams of potassium a day.
Sure.
I think those are the type of recommendations that you're hard pressed to see anybody go home and make a real change with that. So kind of just comes back to the old, less processed foods, more minimally processed foods, more whole foods, and, ensuring that you're building a well-balanced plate with those food items. You are generally going to see less dietary sodium.
Makes sense.
More potassium with greens and different vegetables, fruits and such, nuts, legumes, the old recommendations that we come back to time. And more, if she wanted a more specific dietary recommendation, or she wanted to look at, maybe a plate that's sort of pre-built for her, she could look at the DASH diet. And so that's the diet that we all learn about in, pharmacy school and is often recommended in, reducing hypertension, preventing hypertension. So
sure.
I don't know
That
if you
makes
have any more dietary stuff. I mean, that's a pretty...
Yeah, I think you nailed it. I think from a supplement standpoint, it's kind of to change gears a little bit.
Yeah.
Magnesium.
Yep.
Magnesium is going to be a key thing. And I think too, you want to make sure that if you are taking magnesium, that it's an absorbable, bioavailable, active form of magnesium. Usually those are forms that are attached to chelates, amino acid chelates, like glycinate, lysine, malate. A little bit of oxide and citrate are fine, but you don't want it to be all of that.
Okay.
Those can have a laxative effect, not real systemically well absorbed. So the other thing that's key is, we'll have people say, well, I heard glycinate's the best. I just want glycinate. Why does yours have all 4 of these? Because essentially what happens is even if it's a good form and it's an active form and it's absorbing into your body, you kind of maximize pathways if you take all glycinate. When you take these different forms, your body is absorbing them like an amino acid. There's different avenues, different pathways for it to be absorbed, the magnesium, when it's bound to these different salts and chelates. So that's a key thing, and that's why we recommend a broad one. It's essentially what happens is what you're relying for a mag oxide or calcium carbonate, those types of salts.
Sure.
You're relying on passive absorption via essentially just it dissolves in the stomach and ionically it absorbs versus an active absorption, which is those uptakes via the amino acid pathways that I was talking about.
Okay.
So that's the more scientific way of why is glycinate better than carbonate, those kind of things. Whenever people say that whatever, the supplement's more expensive or it's different than this one, that's really in a nutshell what it is. But back to magnesium itself, it's a natural calcium channel blocker. So essentially that's some meds work that way in a much stronger way.
Sure.
But it helps to relax blood vessels. So you're not going to add this to your med and, crash when your blood pressure is going to dip so low. But in a mild way, it does relax those blood vessels via that mechanism. The other thing is magnesium deficiency is so common. Some studies estimate up to 57% of people are deficient. It has to do with our soil and eating processed food and high sodium. Those are all kind of replacing, sodium in the diet. So the thing you want to watch out for whenever you have a very high calcium diet, say you are elderly, maybe, Deborah's taking a lot of calcium because she's 75 and her doctor told her to, et cetera, for bone health. You're going to decrease intracellular magnesium levels, as well as whenever too much coffee, too much acid, just has to do with the ionic, cellular status. So just watch out for that as well, that you almost kind of end up kicking out some of the magnesium, for lack of a better word, when you have these acidic foods like in sodas. When you have too much calcium, that's could be one ramification of it. So the other thing is magnesium is good for a lot of other things: bone health, mood, muscle relaxation, hydration, obviously blood pressure regulation, and stress response in general. So those are, magnesium is first and foremost. It's going to have other benefits. More specific, hawthorn, taurine, hops, all those are different vasodilators that can, again, in a mild way, help your body to get that blood pressure down and really relax the blood vessels. That's the mechanism to work by. Also, you can look out for L-theanine.
Okay.
That's going to help on the stress anxiety end. So kind of a backdoor way to help high blood pressure is again managing stress, managing some of that anxiety, and it kind of blocks some of the glutamate or the excitatory chemicals in the brain.
Okay. Very cool. Very cool. Hopefully that helps Deborah. Anything else before we move on?
The biggest thing here, she needs to know exactly what her numbers are. I mean, this is not something that I would say we play around with at all.
Right.
Because like cholesterol, you live a lifetime of this subtly persistent, this subtly elevated blood glucose, blood cholesterol, hypertension.
Yep.
It's only 132 over 81. It's not, you're not in stage 2 hypertension per se, but again, it needs to be stressed that, you got to go talk to your doctor about this because maybe you haven't had the ambulatory reading done. Maybe it would be beneficial to be sent home with the 24-hour monitoring just to kind of paint a bigger picture here. Again, we don't have all of her medical history, of course.
Sure.
So there's a limitation and just in answering this question as thorough as we possibly could. But depending on her age and depending on all these sorts of things, the hypertension could be secondary to another condition. There's a little less likelihood to that potentially, but things that are at least worth noting that any sort of conditions that involve pathology of the kidneys, because your kidneys are arguably one of the most important organs as far as regulating blood pressure. There could be underlying issues there depending on age and other factors. The old obstructive sleep apnea could be untreated.
Yep.
And that's, the hypertension is potentially secondary to something like that. And then additionally, more uncommon causes, things that we have discussed as well. We're looking at hypo or hyperthyroidism, Cushing's disease, these, endocrine conditions that it's, you're hard pressed to ever look at this stuff in a vacuum and, throw one or two things at it and see a change. And then also just so she knows at kind of maybe how this will look, she might go to her doctor's office and, she's taking losartan, let's say. She's on 25 milligrams a day, lower dose of losartan. They determine that her blood pressure, given that medication, is not super well controlled and they want to do something else. They might increase the dose a little bit, but they're more likely, at least from my understanding, that they're probably going to add another medication versus maximally titrating the given dose. And so
is that because they work in a different way?
Yes, they're gonna hit this with a different mechanism. So there's 4 or 5 classes or whatever of blood pressure medications that could be used. They're gonna try and just try to cover all bases before maximally titrating the dose, because as you increase the dose, you're at a higher risk of the adverse effects of the given mechanism. So that's often how that plays out. I would say that's kind of really all I would have to add as far as maybe some of her expectations. Exercise is another massive factor here. I would wager to say that maybe she's not exercising quite enough.
Yeah.
And that she can begin to push that. And it's not just aerobic exercise. It's both the aerobic exercise and the muscle strengthening exercise that have a marked benefit on blood pressure. And as far as aerobic exercise goes, I know we always talk about the amount that's required. So shooting for 150 to 300 minutes per week is is like maybe in the back of your mind, the number that you want to think of.
Right.
But as far as level of effort, and there's a multitude of people who talk about the talk test. And so you're like, how do I know that the aerobic exercise that I'm doing is enough? Well, take the talk test. Are you having trouble, holding a conversation? Or you're not straining to speak, but it's at least a barometer to say, okay, somebody can tell that I'm exercising and I'm having trouble carrying, sort of a normal conversation.
That makes sense.
But lifestyle wise, I would say dietary, exercise, 2 of the biggest ones for sure.
Very cool. Very cool.
Stuff.
That's a very comprehensive answer for Deborah's relatively straightforward question that apparently wasn't
never straightforward.
And we still have way more we could have gone into, and eventually maybe will. But
yeah.